Okay, so the first thing that I would do when inserting a Foley catheter is I would go ahead and confirm the physician's order, and then I would go ahead and perform hand hygiene, identify the patient with 2 name identifiers. Then I would go ahead and determine if the patient has any allergies or anything like that to latex or anything like with the gloves. And then the next thing that I would do is I would go ahead and close the door for any privacy. The next thing that I would do is I would go ahead and raise the bed to a good working height for me. And I would go ahead and lay the patient flat supine with his knees flexed, or her knees. And then the next thing that I would do is I would go ahead and have my patient right here, and I would go ahead and position the catheter tray in between the patient's legs. Alright, the next thing that I would do is I would go ahead and start opening the tray, and I would go ahead and start opening away from me, from side to side, and I actually wouldn't touch all past this, but I have limited room. The next thing that I would do is go ahead and open it towards me. It's the last thing. And then I would go ahead and get my sterile gloves that are in it. And then at this time, if I had another table to go to, I would go ahead and move to that table and don the gloves that way. But I would go ahead and just open the package. And I would just don the clean gloves by keeping them above my waist level. Right. Anyway, now I'll go ahead and just fix these gloves. Alright, then if I was at a separate table, I would have just left this on the table. So get that out the way. And then when getting the catheter bag out, I did make a little trash bag out of the bag that the catheter tray came out of. Alright, the next thing that I would do is I would go ahead and get the drapes. Came with it. And I would then get the first drape. And I have the shiny side pointing down. Alright, go ahead and fold it into my hands like this and go ahead and place it underneath the patient as such. Alright, next thing that I would do is I would go ahead and get the second drape, and it does have a hole in it. Alright, and I would then go ahead and just place this over that opening. Alright, so then the next thing that I would do is I would go ahead and then just remove everything. This right here. And I would go ahead and just open my lubricant packet and go ahead and squirt that in there. And then I would go ahead and remove it into the trash. Alright, next thing I'll do is I would open my antimicrobial cleansing swabs and place them into the tray as well, and then discard the wrapping. Next thing that I would do is I would go ahead and take off the opening for this. And I would place the syringe onto the catheter. Alright, so once that is on it, I would then go ahead and use my non-dominant hand to open up the labia minora. Okay, so once that is there, I would then go ahead and grab my anti-swabs, and I would go ahead and start with the side away from me, go around into the trash bag. The next thing that I would do is get my second one, go towards me, around into the trash bag, and then I'll get for my last one and go straight down the middle and around into the trash bag. Alright, the next thing that I would do is with my sterile hand, because this hand is considered contaminated, I would go ahead and grab the catheter tip, go ahead and lubricate it. Alright, and then I will go ahead and start inserting. And I will go ahead and insert it about 2 to 3 inches or until I see urine. And if I insert it a good amount, I will go ahead and just ask the patient to cough. And then by doing that, urine could begin to come out. Alright, so once I insert it, I would then go ahead and insert it an additional 1 to 2 inches. Alright, so then once it is inserted, I will go ahead and anchor that with my non-dominant hand. And then I will go ahead and inflate the balloon. Alright, and this is a 10 milliliter syringe of sterile water. Alright, so once the balloon is blown up, I would then go ahead, because the water will come back, so I would go ahead and just pull this to make sure it is in the right spot. Alright, so once it is in the right spot, I will go ahead, just disconnect this syringe, and then I will go ahead and place this bag onto, no, I would not. I would then go ahead and get a stat lock, and I would go ahead and secure it into the inner thigh of the patient. And then once that is done, I will go ahead and place the bag onto the side of the bed below hip level. Alright, and then once that is done, I would then just go ahead and discard everything into the trash. I would then remove my sterile gloves, or contaminated gloves now, and then I would perform hand hygiene, and I would verbalize what to document, and that would be the time of the completion, the amount of sterile water inserted into the balloon, the size of the catheter, and the amount and color of urine that came out into the bag, and also the patient's tolerance for it. Alright, so then once removing, get all of this out of the way. Okay, so then once removing the catheter, all this will be gone. And then I would go ahead and confirm the physician's order with removing it, perform hand hygiene, don sterile gloves, and I would go ahead and identify the patient with 2 name identifiers. The next thing that I would do is if there is any urine to empty, I would go ahead and empty that and record the amount and the color of it. Next thing that I would do is I would position the patient as I did for the catheter insertion, supine with the knees flexed. And then the next thing that I would do is I would go ahead and remove that stat lock from their leg, and then I would go ahead and I would insert the hub of the syringe into the catheter, and I will not withdraw the water that's inside the balloon. I would then just let it flow into the syringe. Okay, so once all that water is deflated from the balloon, I will go ahead and detach the syringe. And then I would go ahead and ask the patient to take a deep breath in and a deep breath out. And when they take the deep breath out, I would then go ahead and remove it, and I would discard everything into the trash. And then lastly, I would go ahead and remove my gloves, and I would perform hand hygiene, and then I would go ahead and verbalize document the removal of the catheter by documenting the time that it was removed, the urine output, if there was any to take out. Next thing I'll do is document the time the patient should avoid it if it was in 8 hours, and then the patient's tolerance to the removal.